Tonight, teams at IU Health are working tirelessly to improve the lives of Hoosiers living with sickle cell disease.
Rachel Krause shares the life-changing work they're doing to offer support and proper care.
It's empowering to know that I get to be a voice.
Inside IU Health, Kajay Henry spends her days as a source of support and resource for patients and families coming through the hospital system. Her drive to help others started at an early age after a social worker helped her own family.
I had an experience where, due to lack of financials, my family had to rely on a social worker, and the social worker went above and beyond, and I recognized that I want to be that for other patients and families.
Henry was diagnosed with sickle cell disease when she was just 1 year old. The disease causes red blood cells to become hard and sticky, turning into a C shape. Dr. Naveen Manchanda says this causes pain and serious health complications that can impact organs like the brain, heart, and lungs.
So as time goes on, these organs start showing subtle and then severe effects. So as we take care of patients with sickle cell disease, we want to make sure they get adequate pain care, that their care is seamless.
Dr. Manchanda says more knowledge about sickle cell disease and improved standards of care for treating it are needed across the United States to ensure those dealing with it don't live with terrible pain. Henry says as a child, her own care was often fragmented.
We come in, we say that we're in pain and we're not believed, and imagine already in such discomfort and just wanting good care, and you're having to beg for that. I think being in that situation myself, and wanting to ensure that no one else has to be in that position where they feel as if not only are they fighting their body, but fighting the individuals that are here to provide good care, holistic care.
Henry says she's motivated every day to be a voice for others and make sure patients can access the care and resources they deserve.
I want to ensure that that patient population, a disenfranchised patient population, has a voice.
Well, around 100,000 people in the U.S. live with sickle cell disease. That includes about 3,000 people here in Indiana. IU Health is working with the CDC and Johns Hopkins to create a database of patients with sickle cell disease and their access to health care, working to establish a standard of care for people with sickle cell around the country. The goal here, to improve access to pain management, treatments, and medications. We've got more information on those efforts. It's posted at WTHR.com.